Let's talk about the journey of a patient who is undergoing an endoscopic spine surgery. So first of all, as we told, the endoscopic spine surgery is offered to patients in whom three conditions are met. Number one, the disc is damaged more than 50%. Number two, the nerves are weak. And number three, the spine alignment is not that great anymore. And in the endoscopic spine surgery, when we consult a patient in the clinic, we evaluate them clinically, and at the same time, we check them with the help of special x-rays to check the alignment of spine, and we also do the MRI of the spine to understand which disc is causing which trouble and at which location and how much is the trouble. Once all these things are confirmed and the patient has been confirmed for the endoscopic spine surgery, we evaluate them from the anesthesia point of view. We do certain blood tests to check their hemoglobin, liver health, kidney health, lungs health, heart health to ensure that they can safely undergo the procedure. And when everything is finalized, we admit them on the day of surgery itself. Now there is a wonderful thing here. Endoscopic spine surgery can be done both when the patient is awake or when the patient is completely knocked off. We normally leave this decision to the patient whether they want to sleep completely or they want to be aware when the spine surgery is being done. During the procedure itself takes about 35 to 55 minutes to do the endoscopic spine surgery. However, the patient stays in the operation theatre complex for about 4 to 5 hours because of the pre-surgery preparation and about an hour of recovery after the spine surgery. When the patient gets back to their rooms, which is generally 2 to 3 hours after the surgery is finished, they are mostly moving their legs, completely pain-free. They do not feel any kind of pain shooting down the legs anymore. They may feel a bit of pain in the back from where a camera has been inserted. And now a physiotherapist comes who makes them stand, do certain bed exercises and walk from their bed to the washroom. At the same time, we allow them food so that they can drink and eat and become more comfortable. By the next morning, most of the patients are actively going to the washrooms, changing clothes, sitting up in the bed, doing exercises on their own, eating food nicely, drinking water well, and ready to go home. And within 24 hours, majority of the patients have learned the exercises, have understood the medical instructions, and go back to their hotel or home to take care of themselves. We normally see the patients 7 days after the surgery, and at that time we check for the nerves again. We remove the dressing because by this time the very small tiny incision, which is less than 1 centimeter, has healed completely, and now the patients are completely okay to go back to their normal life without any strict medical supervision. So overall, within 2 weeks, most of the patients who had a spine problem which was not tackled in any other manner but by endoscopic spine surgery are now doing their daily chores, taking care of their family, going to offices, driving cars, exercising in the gym, and some of them also go on long treks, pilgrimages, and certain weddings also. So in simple terms, endoscopic spine surgery is a very advanced technology that ensures that the spine patients recover in a very time-bound manner, that too with minimum interference in the normal life.